Dr. Aslam Dasoo, who is the Progressive Health Forum Convener. Dr. Dasoo, thank you so much for your time. You heard the MEC. Your take?
With the greatest respect, good evening. With greatest of respect, I must differ with the MEC quite substantially. There is a food crisis at Hani, but not only at that hospital. It's a province-wide problem. It's a chronic problem. She did, however, mention that, there's a contract management issue. Well, the hospitals don't manage that contract. The people who enter into those contracts have obviously not done appropriate due diligence. And I think to come to the hospital and say to the hospital community that there's no food crisis when there is a self-evident lack of proper nutrition for patients that has been ongoing for some time, and that was very acute last year. You may recall that even the clinicians went out in great protest at this, and and right now it's reached that acute stage again. There is just enough supplies, perhaps, to get us through the weekend, but that's because of extraordinary efforts that have been made to provide hospital patients with protein, that is meat or fish, and so on. They were getting none of that. And when patients are stressed with illness and those who are on special diets don't get the diet they require, their conditions deteriorate. Now, there's a consequence to that, and someone must account for that. Because no patient should ever be put at such risk.
And Dr. Dasoo, yesterday, one of the questions I asked the MEC, because she was raising a concern, and you heard about these suppliers and how they're biting off more than they can chew. And she says that this is an issue where, they need to train the suppliers, because some of them are coming in, they don't really know what they're doing. But one of the questions I said, but isn't this an issue where supply chain also needs to account and those who are taking on these contracts and these suppliers?
Certainly. And I think that's what I meant about the due diligence. No one should be given a contract that cannot be proved to be able to meet the conditions. And especially in such a critical area, you don't take chances here. This is not a training ground. You must be able to secure supply regardless, and any further empowerment you have to do for suppliers, especially new, small suppliers, one understands them, have to come in on the non-critical stuff, have to demonstrate capacity. That is the bread and butter of the contract management. That is a departmental issue. That is the MEC's departmental responsibility. So any crisis at the hospital sits squarely at their door.
Now, when one then looks at this particular crisis, as you say, of course, looking at it from the patient's vantage points, the consequences there are quite detrimental. But let's think about the nurses, the doctors who are now dealing with these patients. What do they go through on a daily basis when they're challenged with these things?
It's quite something. When you think about a hospital like Hani, there's over 11,000 meals a day served there. Now, that takes a huge operation. You cannot have a critical component of the entire operation deficient and expect the rest of it to work. And so obviously the first responsibility is to the patients. The doctors, the nurses do bring their own food, or they can purchase from a canteen and so on. But of course, they also may need to be fed at times, especially if they're in theater or in ICU and can't get out. Now, in all of that, this is nothing new. We've been running hospitals for 100 years, So this problem has emerged over the last couple of decades. And it is this decline can be put directly at the door of the administration of our system. So we have provincial governments responsible for our hospitals, not the national government. And you have 9 provinces, and 9 provinces managing in 9 different ways. So these crises that spring up in our public hospital system constantly are a result of the form of administration we've got. And I can assure you, this has taken years to develop. It's now deep, it's now chronic, and it's going to take a long time to fix. But you're not going to be able to fix it if you deflect from the truth, if you do not accept that there is a problem. And I think that's where we are still at. So we are having a political investiture of this problem. And we know that the political investiture is always self-preserving. And we are coming up to an election, so we are going to hear more of this. I guess it was just impossible for the MEC to say that there is a food crisis, because that would mean that the responsible government has failed. And they're not going to say that. But the health workers on the ground to whom I've spoken and who are experiencing this on a daily basis will tell you the truth. The problem, though, is that they can't speak out because that same administration stifles dissent through intimidation. They can't speak out, and I don't know why. And that's part of the administrative change that must occur.
And it's one of the questions to the MEC, because she was saying that those who are concerned can speak out in public. But I had to remind her, for example, of a Rahima Musa doctor who spoke out, and we saw him being suspended almost immediately. And after a public outcry, he then had to be brought back to work. So, Dr. Dasoo, is this an issue, though? I'm listening to what you're saying. Is it only about the politics, or is it also a little bit of being out of touch, possibly?
You know, you're correct. It must be a bit of both. But the pithy issue really is what happens at the coalface, okay? So we can't get sufficient food. This is a basic function of a hospital. And if you can't guarantee even that, then you can imagine how much other deficiencies there are in the system. You know, our health workers got us through COVID. They got us through COVID at cost of a great number of their lives. And they went above and beyond the call of duty because the state was unable to support the hospitals to the extent they required. And I think when you have a health personnel cohort under such enormous pressure, I heard some of the comments earlier, people complaining about the nurses not caring. I can assure you, they are so overworked. They don't have time even for themselves. Now, the problem with that is that the burnout is causing a further exodus of health personnel from these public facilities, leaving fewer personnel to manage the problem. And here's the now. There is enough money. At the outset, every year, there is money budgeted for staff, but posts that are vacated are frozen because the money disappears. It's misspent, it's purloined, it's misdirected. And so we end up with these shortages. The supply chain here broke down because the suppliers were not paid. They were not paid because there was not enough money to pay them, or different priorities for spending were invoked. So you know, this is what we face. You need a different administration and you need different administrators if our hospitals are going to fulfill their historical function, and that is to provide universal access to every South African. That's what the public health system is there for, and it's constitutional. So there's no getting around this for the MEC or for any office bearers or officials. There's just nothing you get around here.
All right.
Patients have to be cared for in an appropriate way. We know what that is, they know what that is, and they're not delivering.
And it does sound like, you know, a wider conversation and a look into this really needs to be had. And even the MEC yesterday, when asked about these supplies, he says everyone is paid. But I'm listening to you. It sounds like something else is at play here. But let me thank you for your time, Dr. Dasoo. Do appreciate it. That was Dr. Aslam Dasoo, Progressive Health Forum Convener.